and disaster management, and ICT.
Fellow Grenadians, the past few weeks has posed a critical challenge for our healthcare system. But thankfully, we are emerging from what will likely be recorded as one of the darkest periods of our country's history. It has also been a very challenging time for leadership and decision-making. But I've always been confident that we will get through this. The resilience of the Grenadian people has been demonstrated in the past. And in this period, it is no different. There is just something about our people and the indomitable will to survive and to strive. This crisis is far from over. But there is certainly a rainbow peeking through the stormy cloud of sickness, death, unemployment, business closures, and every other impact this pandemic has wrought on our country. The road to recovering will be long and steep, maybe with some undulating periods where we may seem to regress. But ultimately, sisters and brothers, we will get through this. One of the most painful elements of this crisis is the number of deaths occurring in a short space of time. Death is an inevitable part of life as we know it. But the sheer volume at which we have been experiencing death in the last few weeks was unprecedented. It was extremely painful to see and to hear of so many families facing the sudden loss of loved ones. It was particularly disconcerting to see the number of elderly citizens that we lost. The true gems of our country, those whose sacrifices laid the foundation on which we stand today. Their lives obliterated in a flash, taking with them elements of our culture or heritage as a people. It is devastating, and I am heartbroken by the sudden loss of 130 of our senior citizens. I pray that the families of all the deceased are comforted by the fact that their loved ones are resting in peace. In the same breath, I must acknowledge that despite the loss of life, we ought to be grateful because so many others have recovered and remain with us today. To date, Grenada has recorded more than 4,300 recoveries from COVID-19. Others required medical intervention, and their recovery was hard fought. Unfortunately, many people waited too late to seek help, and in some cases, had it not been for the expertise and the dedicated care of our medical team, and the invaluable support system within the healthcare sector, our numbers may have been much higher. Therefore, sisters and brothers, we owe a tremendous debt of gratitude to our team of healthcare professionals, those doctors, nurses, community health team, orderlies, drivers, cooks, cleaning staff, maintenance personnel, and oxygen plant staff. Just about everyone who contributed to the care of COVID-19 patients, whether directly or indirectly. We recognize that the healthcare system is a sum total of all its parts, with each element contributing to the overall product. And we therefore thank all of you for the critical role you play in serving the people of Grenada, Carriacou, and Petite Martinique. Sisters and brothers all, the rate of infection continues to decline, and the total number of active cases similarly continues the downward trend. But this came at a tremendous cost to others who were put on the breadline as non-essential businesses were forced to close their doors. It is an ongoing challenge for government to create that delicate balance between safeguarding lives and protecting livelihoods. Such is the complex nature of this dreaded pandemic. Recognizing the tremendous financial impact of the pandemic, government has initiated a second stimulus package that will benefit a wide cross-section of the population, particularly those who are most vulnerable. Already, the COVID-19 Economic Support Stimulus Secretariat at the Ministry of Finance has processed more than 1,500 applications with more than 500 approvals up to date. Beneficiaries approved for income support have already started receiving payments from October 1st. Those approved under SEED will receive their first payments on October 15th. In addition, 55 small business loans worth about $600,000 and qualifying under the stimulus package have already been approved to help business owners recover from the impact of the pandemic and to stimulate operational growth and development. Given the positive trend we are now seeing and the optimism of the health experts that this will continue, the Cabinet has agreed on a number of measures that will in essence provide an easement of the regulations that have been in place for the last few weeks. Therefore, effective October 5th and continuing until October 19th, the nightly curfew will continue, but will be adjusted from 7 p.m. to 4 a.m., not 5 a.m. as done before. The no movement weekends will be discontinued. This measure has certainly helped to curb the rate of infection, but health experts have continuously indicated that we must learn to live with COVID-19. Therefore, it is imperative that we seek to resume a degree of normalcy as much as is possible, while continuing to safeguard all our people. Retail stores across the country will now be allowed to resume normal operations, but we encourage store managers to maintain 50% capacity in the store at all times as a maximum, and ensure that workers and patrons alike are following the recommended protocols. These are proper wearing of masks, appropriate physical distancing, avoiding large gatherings, and regular hand sanitization. Beaches will be accessible for an extended period between 4 a.m. and 4 p.m. daily. In the food service sector, dine-in services will resume for fully vaccinated persons only. Gyms and fitness centers are also permitted to resume operation. Likewise, daycare centers and businesses in the beauty sector, including hairdresser salons and barbershops. However, there is one caveat, which is based on consultation with representatives in the private sector to help facilitate continuity of operations in the event of future spikes that could otherwise force another shutdown of operations. Let us all avoid this. Having consulted also with stakeholders in the following industries and acting on the general recommendation, employees in the food service, accommodation, fitness, beauty, child and elderly care sectors must be fully vaccinated, or in cases where they have received only one dose, the second dose must be administered within specific period after the resumption of operations. The reopening of schools is widely anticipated by students, parents, and educators. And while I'm keen also to see our children back in the classroom, our primary concern must be their health and safety. The vaccination rate, unfortunately, among teachers and other personnel in the education sector is abysmal. The uptake of Pfizer vaccine, which is administered to children for 12 and above, is also low at this point. Against this backdrop, it is difficult for government to announce at this time the reopening of schools. Sisters and brothers, during the past few weeks, we have noticed our vaccination numbers have continued to improve, with the latest figures showing that just under 25,000 people are fully vaccinated. In addition, more than 10,000 people are partially vaccinated, meaning they have received the first dose of the two-dose regimen. This is a welcome improvement in the number of persons opting for vaccination, but we are still a long way from where we need to be in terms of achieving herd immunity. I must also recognize the role of volunteers in helping us to achieve the significant increase in vaccinations. Over the past 4 weekends, teams of doctors, nurses, and ordinary citizens, as well as faculty and students from the St. George's University, volunteered their time to host testing and vaccinations clinics across our country. This outreach effort, undertaken in collaboration with the public health officials, made testing and vaccination more accessible to many people and contributed to about 4,000 more people being vaccinated, and the Ministry of Health being able to acquire much more data on the extent of the spread across our communities. On many occasions, sisters and brothers, during those weekends, I acknowledge the enormous sacrifice being made by the many volunteers, and it is important I do so again as part of this address. Volunteers, thank you for your selfless service and partnership with the government and people of Grenada, Carriacou, and Petite Martinique. Continuing on the subject of gratitude and patriotism, I must acknowledge the valuable contribution of our diaspora community. The doctors who have traveled to Grenada to provide physical support to the colleagues on the front line. The many organizations and individuals who readily donated supplies to bolster our inventory and ensure that our health team is properly outfitted to execute the challenging tasks they face. Several other initiatives are likely in the coming weeks, including the provision of telemedicine service by our diaspora doctors and healthcare professionals. We are also grateful for the generosity of the medical professionals from Cuba, Mexico, and Nicaragua, who are currently supporting our own healthcare professionals. I must acknowledge the sizable donation expected shortly from Direct Assist, a charitable organization based in the United States. I have mentioned on many occasions that getting through this crisis requires a collaborative effort, and I'm pleased to see that many have seen the value in this approach, volunteering where possible and initiating and engaging in the necessary dialogue, making recommendations for improving this collective fight against COVID-19. I do need to make special mention and reference here to Brother Randall Robinson from the National Democratic Congress, who has been volunteering his services at vaccination and testing clinics. I call on all concerned to follow his example. Sisters and brothers, vaccine inequity continues to be a significant challenge around the world. But we are thankful to our international partners who have ensured that Grenada and our regional OECS and Caribbean neighbors receive this critical resource to help fight the spread of this dreaded virus. Government is currently engaged in discussions to source additional supplies of AstraZeneca and the Pfizer vaccines. We anticipate a second shipment of Pfizer in the coming weeks. The operations of government have not been immune to the impact of the pandemic. Several public officers have themselves contracted the disease, And while we have lost a few, the vast majority has recovered. We have implemented the necessary measures to adapt to the new environment, including the rotation of some staff where necessary, to ensure adherence to physical distancing, remote work where possible, and greater emphasis on digital transformation and online services. We also encourage the continued enforcement of protocols across the government to ensure that public officers and the persons they served are kept safe. Sisters and brothers, I close by saying, these unprecedented times require equally extraordinary fortitude. For individuals and organizations alike, it is not a period for the faint of heart. But we have persevered thus far, and I must reiterate the need for us to continue working collaboratively as a nation in the interests of all our people. It is imperative that we join hands regardless of our political, religious, or other affiliation. That said, we must guard against complacency being allowed to undermine the gains made. The reduction in active cases have motivated us to become even more cognizant of the protocols, ensuring that we safeguard ourselves and our loved ones as we seek a return to some sense of normalcy. I thank you.
The preceding was an address to the nation by Dr. the Right Honorable Keith Mitchell, Prime Minister and Minister for Public Administration, Home Affairs, National Security, Youth Development, Disaster Management, and ICT.